Many of us see our homes as a safe place, especially during the last few months of quarantine. But for victims of domestic violence, home is a dangerous place to be. Dr. Ashley Hink, a trauma and clinical care surgeon at MUSC, noticed her volume of patients fluctuating during the pandemic.
For the first few weeks, we saw a decreasing amount of injury overall because people were staying inside and not interacting in the community much. However, over the last month, we've seen a pretty dramatic increase in the number of intimate partner violence related injuries and really violence overall.
She suspects a number of factors are to blame for the spike of injuries: uncertainty, economic distress, and being around an abuser more frequently. With South Carolina still ranking as one of the worst states in domestic violence homicide, Dr. Hink believes much needs to be done, specifically in communities of color.
We need to address the underlying social determinants of health and disparities. And typically, communities of color experience violence disproportionately. And we need to address these themes systemically in our public health and healthcare system, and also as individuals, and reach out to people who are experiencing this and advocate for more assistance.
Approaching the topic can be difficult, especially with our loved ones.
One of the most important things that they can do is reach out and say, hey, this is not a healthy relationship. You are loved, you deserve better, and let's talk about ways that we can help you.
If you suspect that someone you know is experiencing domestic violence or abuse, Dr. Hicks shared a number of resources in addition to the 24-hour hotline 1-800-799-7233. You can find links to those resources down below. In studio, I'm Katie Turner. Count on 2.